You want your kids to stay healthy as they are getting back to school. I mean, let's be honest, this is the time of year when colds, flu, allergies even flare up. Well, joining us now is Dr. Karin Hotchkiss, the Chief Medical Officer for St. Joseph's Children's Hospital, a pediatric ear, nose, and throat specialist. My daughter already even has a cold right now. Doctor, I am so glad to be talking with you. How are you today?
Great, thank you.
So let's go ahead. Well, it's such good information. I mean, let's first rewind. What is the best way to keep our kids healthy during this back to school time of year?
Great question. I think we can get back to basics. We're back to school. Let's get back to school basics. As far as health goes, thinking about eating great nutrition, staying away from processed high sugar foods are great. Exercise, getting outside, that fresh air, super helpful. And then sleep. Easier said than done for busy families, but really trying to get those 8 hours of sleep so we can be ready and fresh for those mornings.
And I'm going to ask you about a conversation that we literally had in my house this week. How do you tell the difference between allergies and like cold symptoms, and what do you need to know? I mean, navigate this because again, we're all having these conversations.
That can be tricky for sure. Florida has a lot to offer as far as allergies go. We are in the midst of our second allergy peak. So grass, ragweed, and mold is kicking up right now. So a couple things. Things usually start off similar: runny nose, nasal congestion. Allergies tend to add the next level of itchy, watery eyes. Sometimes you'll see skin flares as well. A lot of times allergies are triggered by being outside right now. So grass, ragweed, and mold. So if you're out playing in the soccer field or exercising outside for PE class. Colds tend to progress and get more of that thick nasal mucus, maybe the crusty nose, crusty eyes, wet cough, and then certainly flu. We're looking for fever, noted fatigue, big symptoms, stop traffic, may want to go see a doctor for that.
Thank you. I wish I could just put those notes in a little card to carry around with me. And I do want to go back to keeping the immune systems overall. I mean, I'll be honest, my daughter is a picky eater.
Yes.
I just want her to be able to, be stronger when it comes to her immune system. It's something I worry about. Do you get that question a lot?
I do, and interestingly, in the ear, nose, and throat world, 1 in 8 kids may have some type of weakness in their immune system that predisposes them to getting sick. So always asking that question in the back of my mind if something seems a little out of line. Now, average child gets 8 to 12 colds a year, just in normal school. My question is how many of those are progressing and needing doctor intervention, antibiotics? So usually rule of thumb in my mind, my little red flags go up if we see 3 infections in 6 months that need antibiotics.
Okay, so if you have to go to the doctor within 3 times, when do you know when to take the next step and go to the doctor? Is there a rule of thumb that parents can have on that one too?
So typically viruses will run their course 5 to 7 days. If things progress, again, you're seeing that thick green goopy nose, that really wet hacky cough, that is not an allergy cough, that is something else going on in the lungs. And then looking for their overall countenance. Are they tired? Do they have what I call that wet noodle? They just don't want to get up and go to school. Those are signs you might want to bring them in to get checked.
I love that. Okay, now if a child does need medical attention outside of those, doctor's office hours, I know you've got some convenient, easy ways to be able to get that help. What are they?
Absolutely. Well, I've been a BayCare partner for 20 years, and I got to say they are doing a great job of improving access for our Tampa Bay community families. So BayCare urgent cares are throughout the BayCare area, the Tampa Bay area. You can find a local if you like the brick and mortar. They have extended hours, and they now see patients down to 6 months of age. And then if you like your devices, get on your phone. The BayCare Anywhere app is great, 24/7 availability. You can pick your doctor, pick your time, pick your place, hop online. You don't have to be a previous BayCare patient to jump on and get access to care.
I got to tell you, Dr. Hotchkiss, thank you. Absolutely. Thank you so much for being here. Of course, for more tips to keep your kids healthy and the resources at BayCare, go to BayCareKids.org and BayCare GetCareNow.org for all those resources she just touched on.